This is Bay Radio.
Hello. A tragic story has been in the Spanish press this week of a 20-year-old man who went out partying in Madrid before not realising that he'd caught Covid-19. And he went on to pass the disease to his 8-year-old grandma, who is currently in a critical condition in an intensive care unit in La Paz Hospital in the north of Madrid. Now, this 20-year-old man was what's called asymptomatic, meaning that he did not present any symptoms of flu, fever, or indeed coronavirus. And he was contacted through track and trace personnel after a related positive infection at the nightclub that he had visited. This story became in the public knowledge after a particular doctor at the intensive care unit at this hospital made a series of tweets this week effectively blaming the boy for his grandma's infection, as he said it must have come from her, for she was not going out at all for her own fears of catching coronavirus in Madrid, which is currently one of the epicenters of this so-called second wave that we're experiencing in the summer. I am Joshua Parfitt, the digital editor for Bay Radio, and today we're going to look at the statistics that have just come out this evening from the Spanish Ministry of Health, and we will also speak to family physician and long-time serving Dr Henk Landa, and we're going to be asking him, how dangerous are asymptomatic patients? Let's go. Today, the Spanish government has announced 1,690 people tested COVID-19 positive a day previously. This is already a 200 increase on Monday and Tuesday's figures. However, the Spanish government regularly adjusts its figures, meaning that if we divide the number of cases announced over the last week by 7, we actually get a daily average of 3,500. The 1,690 figure announced today also lacks data from the autonomous region of Madrid, which experienced technical problems. If we look further down to today's report, we can see a much bigger graph of asymptomatic patients. These are patients who test COVID-19 positive despite showing no symptoms such as coughing, sneezing, sore throats, and so on. These cases are beginning to make up nearly 50% of new contagions each day, as we can see in this graph. Figures also show that around 70% of new coronavirus cases in Spain's new normal are all aged under 30, an age group much more likely to be asymptomatic. Recent studies, such as from the University of California, have suggested that just by talking to an asymptomatic person, viral transmission is possible. So we called up Dr Henk Landa, a family physician and doctor for 31 years on the Costa Blanca and currently at Denia's Hospital San Carlos. Let's see what he had to say. Dr. Landa, we've seen some quite alarming statistics coming out. Yesterday in Almeria, they announced that 95% of their new cases were asymptomatic. 67% in the Valencian community said so. There was some debate in Madrid about it being as high as 60%. So how dangerous are asymptomatic patients?
Oh, very good question. That debate is still waging. We really don't know how dangerous they are. Obviously, asymptomatic people, meaning people that have no symptoms, that are feeling completely healthy, that will be very surprised if someone tells them that, look, you have the virus on board. These asymptomatic people usually have a very low load of virus, which we call the viral load. So that's very important to keep that in mind. So someone who's really acutely ill usually has a very high amount of virus on board. So his or her viral load will be very high, and therefore their transmission rates are far higher. So someone who doesn't have symptoms, usually has a low viral load, will transmit the virus, can transmit the virus if they sneeze for hay fever, or if they start yelling or singing in a very loud voice, or start yelling at each other in a discotheque, then little droplets, even from healthy people, can go around and they can transmit the virus. Now, we just don't know the rate of transmission between these asymptomatic people. Now, this whole phenomena started as we started testing, and also started when we started tracking, because in days when this whole pandemic started, we didn't even have testing. So we said, don't bother with testing, just self-quarantine, stay at home. And we didn't have a clue of how much of the population actually was affected. We only had guesses. So as we're testing more people and we're having the trackers, because in the early days of the viral pandemic, we weren't really testing. Now what we're doing is we're trying to identify individuals who have the illness and try to identify all their contacts. So we start digging into all their contacts, all the people they've been with, in close contact with in the last days. So they come up with huge lists of people that we start testing. Now, and most of them come up asymptomatic. Actually, that is good news. That's meaning that our system, of detecting is very, very powerful, that we are actually detecting far more than we would even expect. So that's where all the asymptomatic people come from. So I don't think it's something to be afraid of. No, I think it's something to be happy about, because we are really digging up loads and loads of cases. Okay, so what we have to know now is how the evolution will be in weeks to come, because as you know, if I have asymptomatic carrier, I might develop the disease, I might not. My immune system might clear it on its own without me even noticing it. And then that's the end of it, okay? I don't think we should criminalize young people. I don't think they're doing it on purpose. I see many young people protecting themselves. But let's be honest, we all were young one day, and you can't go on forever without having a party. So these parties are big social events, and they are reduced level, but still there's more contact and there's more people spreading the virus. There is no way of stopping that completely.
Thank you very much for your insights on that. Just to follow up on that question, we started this video with a news story that's come out this week about a 20-year-old young man in Madrid who went on to infect his 80-year-old grandma. Based on what you've been saying, though, would you advise young people listening to this, or parents watching this, to quarantine their kids as much as they can to make sure this doesn't happen? Or is this just a really freak, tragic occurrence that has happened during a pandemic?
Well, I think, look, you can't just lift one case out and then magnify it and say this is terrible. Obviously, there are many middle-aged people that have infected their elderly. A lot of elders have infected them. A lot of health workers have infected their patients. So we can't really say who is now the cause or who's to blame. I think, look, all of us, we have to be very careful. And we have to be as much on our qui-vive as we can. But look, being asymptomatic, you just don't know if you've acquired the virus. So how are we going to blame someone who has no symptoms and is going to pass it on? All right, so that's number one. That's something I would like to point out. Number two is that we all have to work very hard to be conscious. So also, young people have to be conscious that they can acquire the virus, they can be a carrier, and they can pass it on. I think the vast majority of young people is conscious about that. And what I'm noticing with my children, they're like in this age group, they're like 20 years old, 26, 27. They're very conscious that when they go out, they only go out with their same group of friends. They try to narrow it down. They don't go to big, large events. There are hardly any big, large events anyway. So they are very conscious. And I think most of young people are doing that.
Thank you very much. That was Dr Henk Landa from the San Carlos Hospital in Denia. And there we have an overview of asymptomatic Covid-19 patients and what it means for Spain as we battle this recent spike in infections over the summer. I am Joshua Parfitt, the digital editor for Bay Radio. And as ever, please subscribe to our YouTube channel through the link you can see at the bottom right of the video. Like our Facebook page, download our app wherever you get your applications. And of course, please comment on our videos or on social media, or feel free to email me, joshua@bayradio.fm, with any coronavirus questions you may have and anything that you would like to see investigated. Thank you and goodbye.